Hello, have you ever wondered about a way to change the way you think? Today I'll inform you about cognitive behavioral therapy, or CBT as I'll refer to it in the remainder of my speech. CBT is useful for a range of problems including depression, anxiety disorders, alcohol and drug use problems, marital problems, eating disorders, and severe mental illness. CBT is defined as a short-term therapy technique that can help people find new ways to behave by changing their thought patterns. I graduated from a year-long discipleship program with CBT as the basis for changing the way I think. I also help chair a faith-based CBT recovery meetings every Thursday at my church called Be Complete. CBT is based on several principles, and three of these principles can include things like, for one, psychological problems are based partly on faulty or unhelpful ways of thinking. Two, these problems are also based partly on learned patterns of unhelpful behavior. And three, people with said problems can learn better ways of coping with them, thus relieving their symptoms and becoming more effective in their lives. Now, there are several strategies used to help change thinking patterns. Some of these include, but are not limited to, first learning to recognize one's distortions in thinking that are causing problems in their lives, and then to reevaluate them in light of reality. The second one could be gaining a better understanding of the behavior and motivation of others, to maybe possibly help you understand the motivation of your actions or thoughts, or using problem-solving skills to cope with difficult situations. A fourth one could be learning to develop a greater sense of confidence in your own abilities. New breakthrough in science has taught us that the brain is not hardwired, meaning that it can be reprogrammed in a sense. The brain has the ability to change its neurosynaptic organization in a process called neuroplasticity. That's a lot of fancy science words for you can reprogram your brain pretty much. It's, changing your way of thinking is possible, but it's not easy. It takes a conscious effort to want to change. It also can take months or years to change your thoughts and behaviors, because sometimes most people have spent their whole life building these thoughts and behavioral patterns. And studies have shown that CBT can be more effective than medication in many of these problems, including social anxiety disorder. Often medication is used in place of CBT, mainly for cost reasons, because it takes a long time and lots of counseling and lots of time to do this. So some people can't afford that, or their insurance doesn't cover it. So a lot of times they just treat the symptoms, then try to fix the underlying cause of these behaviors or thoughts. Because CBT is also helpful for behavioral patterns. You can use strategies such as facing your fears instead of avoiding them. You can use role play to prepare for potentially problematic interactions with others. You can learn to calm one's mind and body. For me, I'm in a Christian-based program, so I use a verse. It's pretty much I take the thought and I say, well, what does God say about this? And then in a sense, it's like you keep changing your thought patterns. It'll be like the road. It'll become the road most traveled, and that's the neurons will eventually take the easiest path in your brain. So it's not easy. It takes time, and usually a person works with a psychologist and collaborates a unique strategy that best suits the person's need. Sometimes medication is used early in the treatment to help stabilize someone that may be experiencing large amounts of stress, anxiety, or depression. And this is something that you would have to work out with your doctor as part of the cognitive behavioral therapy process. And hopefully today I've informed you about a technique that could possibly help you change any negative behaviors or thought patterns you have in your life. Thank you.